Early sessions are so important. They're important because they are going to determine, first of all, whether or not a couple continues with you, whether or not the couple has hope, and that they can see that there is a way forward, whether or not they have a sense of relief that they're not alone and that they have good help and tools that are going to help them not feel alone, whether they feel understood by you, but also challenged by you. And these early sessions, and we're going to talk about when therapy starts. We're going to talk a little bit about the first phone call and whether or not and how you are able to focus on the things that are going to actually make a difference. So when does therapy start? Well, I think that therapy actually starts in the mind of one of the people before you ever hear from them. And often a person who's considering therapy, and especially considering couples therapy, is they're scared many times, and they're scared to tell their partner, they're scared to reach out to you. And yet when they make that decision to actually reach out, usually the focus, and I'm going to use some generalities, but usually the focus is on how they want their partner to change and be different. And so for most, I know some therapists just now schedule online, but still the majority of therapists call people back or have an initial either 15-minute consult on the phone or some way that they're connecting with the couple before they're actually in the room with you or on Zoom with you. And so when you get back in touch with a person who's reaching out, one of the things in my mind is I want to be able to influence the first session. So for me, therapy starts as soon as I'm engaging with that person, either initially by the email response and definitely by the time I'm talking with them. And what I'm thinking about is obviously the first thing of like trying to know, why are they coming? Are they coming to change? Are they coming to make a decision? Are they coming to end it? But I want to be, as much as possible, improving their attitude about change and helping them come into a first session with a different focus than a bad behavior partner focus. And, I read this thing many years ago now in Vogue magazine, and it was from a Hollywood movie star. And she was quoted as saying, that she absolutely loved being in couples therapy. And she said, I have promised myself I will never, ever be in an unsupervised relationship again. And I love the way she said that. But that's the reality is most couples perceive therapy as you are going to be like a mediator. And you are the person who's going to decide who's right and who's wrong and who's good and who's bad. And so when I'm talking to people before they ever come in, I want to create a different focus than them getting ready for the first session with a bad behavior story about each other. And I know that the leadership that I provide or you provide in that first session is so important about everything that comes after that. And so we're going to spend a lot of time now really talking about that first session or first couple of sessions and what's involved in really good leadership. So to influence that phone call, I usually will start out by saying, can you give me a quick headline of your situation? And I am thinking about that quick headline as really not more than 1 or 2 minutes of the person describing to me why they're calling, and what it is that's going on. Now, because I do know that there's usually anxiety connected to that call, I want to start connecting with that person. And we all learn about making good contact with clients. And part of connecting often is normalizing the reason that they're calling when you're able to hear it. And that might be something like, because most couples are comfortable saying something like, we have a communication problem. That's the single thing you'll hear most often. And so you can even begin that connection by saying, you're not alone. You know, communication is the most common reason that so many couples call. Another thing is that Pete and I work out of a developmental model, and I'm not going to be able to go through many elements of the developmental model today, but there are developmental times that are very, very common for people to call. And so when you're normalizing and helping people not feel ashamed of calling, and you hear something that is related to a developmental transition or milestone, that's another way that you can give compliments to them. A very common example here is after the birth of a child and the couple has not been able to reconnect. And so perhaps somebody's telling you on the phone, they're saying, well, you know, we had our first child about a year ago. And ever since then, we've just been fighting more than we've ever fought in our life. And you might say, you know, that's so common. Many couples have a hard time making that transition from being 2 to being 3 people. And you're not alone in that. And there are some very specific reasons why that transition can be difficult. And when you come in, we can take a look at that. So again, you are looking for those touch points where you can connect and really give them a compliment or a positive stroke for reaching out and taking that risk with you. Now, I want to start to create some accountability on that first phone call. And this can be a little bit trickier than what I've been talking about up till now, because I am looking for a place where I might say to somebody I'm talking to, you're describing the fact that the two of you have these really painful fights. And I'm imagining that you would like a relationship where you're not fighting so much with each other. Is that true? And they might say, yeah, of course, I don't want to be fighting that much. And then I might say, you and I don't know each other very well yet, but I wonder if you could tell me something that you think you contribute to the fights. And I'm listening carefully and hoping that somebody will be able to say something like, well, I have a quick trigger, or I tend to blame, or I can be bossy, or some awareness of what they contribute to the situation. And then I will ask them, or if they're talking about communication, what is it you think might be required of you to become a better communicator? What do you think it would take on your side to start to shift things? And whatever they tell me that really just has even a little tiny element of accountability, I might say back to them, wow, I love how open you just were to letting me see your part in this, or letting me know that you bring your own challenges to this, and that you are willing to do something to be a better communicator. So you're really setting a strong, from the very beginning, a strong sense of change is going to come, and it's going to come from you beginning to take personal accountability.